Sophie Mokoena is in studio with us to discuss the vaccine rollout, not only in South Africa, but on the African continent. A very good afternoon to you. What can we expect from this afternoon? And is South Africa moving quickly, like our president has suggested in a statement?
Well, I think these are the important visuals that we are seeing today from the southern region, that is SADC, but also on the continent, and particularly in the sub-Sahara region, and of course the global south, because what we have been experiencing the past 2 months, we saw vaccination happening in the developed nations, like in Europe, like in the United States of America, you talk about UK, and other developed nations. And now, for the first time, we'll be able to understand and celebrate the fact that the whole vaccination process is starting in the poorer or developing countries. And these visuals are historic, particularly for people who have been asking questions around the vaccine nationalism, because we know that there is a serious problem where developed nations have bought these vaccines and poorer nations are struggling to procure the vaccines. And this will bring hope to poorer people in poorer countries and developing nations, that finally they will also be able to access the vaccines, particularly via COVAX, the facility set up by the World Health Organization that will ensure that poorer nations and developing countries are able to access the vaccine. And therefore, the first picture that will go out worldwide of the president, if he's taking that vaccine, will be a big story around the world, not only in South Africa, but around the world. You'd recall when Joe Biden and Kamala Harris in the United States of America took the vaccines. It was a big story. So today it will be a big story, because it is the story that speaks to the nations that have been deprived access to vaccine are beginning to get those vaccines. We know that tomorrow in Zimbabwe, a similar picture will be beamed around the world.
All right, we know that there have been many challenges when it comes to vaccine nationalism. In South Africa, receiving 1 million doses of that AstraZeneca vaccine, which we can't actually use. 80,000 Johnson & Johnson vaccines arriving today. Is it enough, and what other challenges were there?
It is not enough. I think the challenges the country faced with the AstraZeneca vaccine was a problem. It was a setback. I think, but South Africa was saying, or is saying today, we will soldier on, we will find the alternative. So the story today is South Africa powering ahead to try and find a solution. But as the country is doing this, they will have to ensure, the leaders, that they take the nation on board. The concerns the nation is raising around the issue of efficacy and accessibility and who must get it first must be addressed, particularly health workers who are still asking questions. If the health workers are still asking questions, what about ordinary people? And I hope today the president will bear in mind, when he is commenting on arrival there, about the questions that are being raised by ordinary South Africans as a head of state. Because if the nation is lost, this program will not be effective and successful. But also to continue to emphasize the fact that vaccine is just one issue that is going to help us to fight the COVID-19. We must continue to observe the COVID-19 protocols. I'm talking about wearing of masks, keeping social distance, not being in crowded places, and also washing our hands and using sanitizers, because you have to use many strategies to fight COVID-19. You cannot rely on vaccine only. Secondly, the vaccines, it will take time before they become effective, and also before everyone gets it, particularly people who are willing to take the vaccines. And therefore, the message must be clear. This is a one small step. we must continue with what we have been doing in terms of taking precautions as directed by the World Health Organizations. And I expect the president to emphasize that, but also answer the lingering questions from the nation, particularly from the frontline workers.
All right, now you've prepared some graphics in order to give us more insight into the vaccine rollout. If you can just talk us through those, please.
Yes, let's take a look at the first graph. The first graph, when you look at this first graph, it speaks to countries in the southern region that have started with vaccination. You'll see Seychelles is vaccinating its citizens as we speak, Mauritius, the two island nations, and then in another important issue when you look at the graphics, South Africa and Zimbabwe are going to do this very soon. South Africa today, any time from now, and Zimbabwe much later. And then when you look at the rollout again, you'll see that Seychelles is using Sinopharm, and Mauritius is using Oxford AstraZeneca. Egypt is using Sinopharm from China. Morocco is using AstraZeneca. And Guinea is using Sputnik from Russia. We are using Johnson & Johnson. We got those 80,000 doses from Belgium, but the headquarters of Johnson & Johnson is based in the United States of America. Therefore, you can see there's progress, but when you look at the quantity, I think Morocco is leading with AstraZeneca with 1.7 million doses that have been administered already, and followed by Seychelles, 50,000 from China, and then you have Sputnik, Guinea, also quite a number of doses, 55,000. You then have other countries as well. And I think for us, it's 80,000 for starter. But as the government has announced, we'll be getting more doses from other manufacturers. We are not only looking at the Johnson & Johnson. Those doses, the AstraZeneca 1 million doses, the president and the minister have announced that they are going to be donated to the African Union. The African Union will give these vaccines to countries that are not having a problem of the variant that we have in South Africa that was detected a few months ago, the 501YV2. That has led to us not being able to use the AstraZeneca. But there are countries on the continent who are not having that kind of a variant, and therefore the AstraZeneca vaccine will still be effective.
All right, Sophie Mokoena, SABC News foreign editor, joining me in studio.